My Safe Place is an online mental health platform co-founded by Pooja Kumar, Rashi Kumar and myself, Arushi Luthra. The three of us have a strong background in psychology, medical sciences and business and are very passionate about mental health. Each of us has very closely seen the struggle that people go through to find the right support and services for mental health issues. We realize that there is a need to simplify the process of seeking help and raising awareness about the different options available for mental health support and making these more accessible and affordable for all. We launched this platform early last year when there was a noticeable increase in the need for mental health support due to the impact of the pandemic. Through our platform, we offer one-on-one consultations, support groups, innovative workshops and webinars for individuals and corporates. In the past year, we have been able to touch over 5,000 lives and hope to reach out to many more.
India has been named one of the most depressed countries for several years now. The continued neglect of mental health has been repeatedly attributed to the stigma and lack of awareness surrounding it. The COVID-19 pandemic has affected the lives of many, both directly and indirectly. While on one hand, people have been dealing with the rising case count and increasing death toll, lack of beds, oxygen, and medicines, on the other hand, people are battling a host of other issues that impact their mental and emotional health, including loneliness, stress and burnout, financial pressure, grief, loss, increased amounts of depression, domestic abuse, and a host of other issues. In fact, the BMC Empower one-on-one mental health helpline received about 45,000 calls within the first 2 months of the pandemic last year. Of these, about 82% of callers complained of anxiety, isolation, uneasiness, and depression, while others spoke about sleep irregularities and exacerbation of existing mental health issues.
It's in these uncertain and unfortunate and stressful times that people need a sense of security. We all know that the bills that go to meet a mental health treatment are rocketing. And when this bill is not able to be paid, that's when the treatment stops and then there's an unfortunate relapse of the entire mental health problem. So the need of the hour is to invest in an appropriate insurance policy that takes care of both mental and physical health equally. So mental health insurance is going to give us all tremendous respite. It is probably the pillar of support that we require to help us face the financial and mental burden that goes in paying the mounting treatment bills. There is an unmet need for mental health insurance in India, but steps are being taken in the right direction. In June 2020, the Insurance Regulatory Development Authority of India instructed every policymaker to have a policy for mental health just by October 2020. The Mental Health Care Act 2017 was initiated and implemented in 2018. Now, this act clearly specified to the policymakers that they have to give an equal weightage to mental health and physical health. And this was a step in the right direction.
There is a serious need to increase the awareness around psychological distress and problems, and also reduce the stigma associated with it, as it often prevents people from seeking appropriate mental health support, reporting their conditions, and inquiring about insurance. Especially with family and corporate insurance policies, people do not reach out or ask or inquire about their insurance coverage due to the fear of log kya kahenge. An increased focus on mental health issues in insurance policies will help create the awareness that mental health problems are just as real and important as physical illnesses and help reduce the stigma around it.
When choosing a health insurance plan, do check with your agent about things such as the range of mental health issues that are covered under the plan, the coverage value for these, whether or not they provide cover for therapy sessions or counseling, and also the coverage provided for testing, medication, or anything else that may be required. Costs can add up quite quickly, but having a good plan can make mental health support more accessible and affordable so that you will not hesitate to reach out for help when needed.